and welcome everybody to this 1-hour webinar. I think we had people from all across the world, certainly from throughout the United States, clinicians, diagnosticians, teachers, a number of different professionals who are obviously interested in diagnosis and classification. So our webinar today will use a case study, and what we'd like to do is to demonstrate how clinicians can use data from a number of different standardized tests, including the Wechsler scales, the WISC-V, in order to understand whether or not a child is eligible for and whether or not the child needs direct specialized instruction, but also to think about maybe how you decide which assessments will answer your specific questions, and then also how you analyze the data to determine the examinee's educational needs. So in terms of our topics today, I want to focus first on selecting appropriate assessments. And in order to select appropriate assessments, we'll want to take a look at the referral concerns. Then we want to administer and evaluate the data from the assessments that we select. We want to analyze the data to make diagnostic decisions. And then we like to talk about the data with respect to the examinee's educational needs. I want to say just a few words about the title of our webinar today. I deliberately selected the title or the terminology learning difference as opposed to learning disability to illustrate that there are times when examinees might actually be referred because of a learning difference. And the learning difference may or may not rise to the level of a learning disability. If in fact the examinee is struggling in the classroom because of a disorder in one of the basic psychological processes to which the Individuals with Disabilities Education Act refers, certainly we will use the classification label, which would be specific learning disability. So let us get started then by thinking just a little bit about how we select appropriate assessments. And I think the selection of an appropriate assessment really begins with the referral concern. So I want to present the referral concern or the reason for referral here, and all of the slides that I'm going to show you here today are included in the handout that we sent you with a reminder email. This is going to be information about a young man whose name is Aaron, and he was referred by his teacher for comprehensive psychoeducational evaluation, and the teacher was concerned about his lack of engagement during class lessons and his consistently low performance on both standardized achievement tests as well as classroom tests. So I want to say just a few words, I want to say a bit more about the reason for the referral, but before I do, I'd like us to get to know Aaron just a little bit. So who is Aaron? Aaron is in grade 5, and he is 10 years old, and immediately when you get that information, you start thinking, well, his grade placement is appropriate for his age. He probably was never retained. When you meet Aaron, you will notice that he has this really engaging smile. He's easygoing. He's friendly. He enjoys the company of others. He likes being around his peers as well as other adults. He likes to play baseball and basketball. He believes he's a really good athlete. In the school setting, he is finding himself struggling especially with reading and language arts, and he's actually been receiving educational support services since he was in grade 2 when he earned extremely low scores on reading and language arts tests toward the end of the year. One of the things that he will tell you is that as much as he likes school, he seldom reads for pleasure. So all of these pieces of information information we'll keep in the back of our mind as we start thinking about why it is that Aaron might be struggling in the classroom, why it is that he might be manifesting this reduced engagement as described by his teacher. So when you look at the family history, certainly he's from a two-parent household, has two older brothers, a younger sister. He enjoys spending time with his siblings. Noteworthy, I think, for our purposes is the fact that when we look at the developmental history, his parents reported that he started speaking later than their other three children. And then also his parents noted that when he went to daycare as well as to preschool, that the teachers expressed concern about his articulation, his expressive language, as well as his drawing skills. And all of this information we're starting to interpret, starting to think maybe about the production of language. We're starting to think about maybe the oromotor structure. You're starting to think with respect to drawing about any visual motor integration or fine motor skills. Aaron himself will tell you that he enjoys school. But as you talk to him and listen to him ask questions about academic subjects, he appears noticeably uncomfortable, especially when he starts talking about his perception of his own academic skills, especially in reading and writing. He doesn't like to read very much, and he thinks that schoolwork is really difficult. He does tell us that he does his best, both in class and with his homework. And he will tell you that math is his favorite subject. And actually, the fact that he's telling us that math is his favorite subject, one of the things that we did as part of that referral was to look at his cumulative record, and we found, in fact, from his cumulative record that his affinity for math really is documented on his report card. So in grades 1 and 2, for example, his grades for math were substantially higher, were much higher than his grades for language arts. As the years have passed, you notice that his grades for math have declined, and we'll kind of think about why that might be. So I mentioned before that he's been receiving educational support services since second grade through district remediation programs. One of the things that I want to point out here, because I think it's going to be instructive information later on, is that the remedial program, just like the regular classroom, they use a whole language instructional program. So their emphasis is on improvement of reading comprehension as opposed to a systematic approach toward decoding skill development. So you want to keep that in mind as we start to collect and analyze data, because we want to think about the instruction that Aaron has been receiving over the years. Now, when we talked to his teacher, I mentioned before that his teacher is concerned, his fifth grade teacher is concerned about his poor performance in all academic areas, including math. He doesn't do well on tests, and she's really concerned because he doesn't seem to be engaged. He doesn't participate in classroom discussions. When she asks him a direct question, he tends to smile, but he usually doesn't offer a response. And this lack of engagement really is worrisome, and she wonders about the lack of engagement in conjunction with his relatively low scores on group achievement tests and classroom tests, and she's beginning to wonder whether he might in fact have an intellectual disability. So you think about the referral information, and then you're going to start taking that information and thinking about the assessments that will allow you to answer specific questions that were raised based on the reason for referral. So certainly you're thinking about consistently low achievement across content areas. You're thinking about the lack of engagement You're thinking about the low verbal production or the low verbal responding, and you'll probably start thinking maybe about a classification system. And because we're working with a child in grade 5 in the school setting, we'll start thinking about the classification system used by the Individuals with Disabilities Education Act and implemented by our states. So when you think about the appropriate assessments, there are certain specific questions that you're going to ask yourself. First of all, you want to be able to confirm what the teacher's reporting, that he might in fact be achieving below expected levels when you look at age level standards and grade level standards. So one of the questions that you want to ask and select assessment tools to answer would be whether or not he's achieving age and grade level standards. And then you want to think about his achievement relative to his abilities. If he is achieving below expected levels, might it be because of a global deficit in cognitive abilities? And you answer that question, and then maybe you notice that there is not this consistent pattern of below expected level achievement, but there might be some relative strengths and there might be some relative weaknesses in terms of academic skills as well as in terms of cognitive skills. So we will okay, I'm confusing myself because I was trying to read the chat box here. Let me just go on and talk about the two disability categories from IDEA that actually might require some focus when we think about the referral information. First of all, you may think about whether or not Aaron manifests a specific learning disability or maybe a learning difference. So when you think about IDEA and the 13 categories, the 13 possible categories that we might be able to use, certainly you're thinking about this one. He doesn't achieve age or grade level standards, maybe in one or more of the following 8 areas. Certainly oral language, oral expression, listening comprehension, written expression, and then the 3 reading areas as well as the 2 math areas. And certainly we'll talk about that with respect to the assessment question that we posed. Also, when you think about a specific learning disability, the criteria, you may certainly look at the child's scores compared to age or grade level standards, but you may also make the determination that the child is not demonstrating sufficient progress to meet the grade level standards by the end of the year in one or more of these 8 areas when using response to intervention, a process based on the child's response to scientific research-based intervention. Or maybe a third method that you might be able to use is to look at whether or not the pattern, there's a specific pattern of strengths and weaknesses in performance, maybe in achievement, or in both relative to age or grade level standards, or there might be a pattern of strengths and weaknesses in intellectual development. So either one of these would tell you whether or not, based on the data, the child might be might meet the criteria for classification of specific learning disability. In addition to those inclusionary criteria, you also want to make sure that your data will allow you to rule out maybe disabilities in terms of vision, hearing, or motor, an intellectual disability. IDEA refers to that as mental retardation. Certainly we know that the terminology has changed now, intellectual disability. You also want to rule out emotional disturbance, cultural factors, environmental or economic disadvantage, and limited English proficiency. And above all else, you want to make sure that if there is below grade level achievement, that it is not because the child was not provided with appropriate instruction. So we should be able to document that appropriate instruction was provided. But based on what the teacher said, we also want to focus some attention on the intellectual disability category. The other reason that we want to focus on this is because it is one of the classifications that we need to rule out before we can diagnose a specific learning disability. So when you think about an intellectual disability, you're thinking about significantly sub-average intellectual functioning compared to a specific learning disability where we're most often thinking about at least near average intellectual abilities. So significantly sub-average intellectual functioning, maybe an IQ score of 75 or lower, or 70 or lower, and the significantly sub-average intellectual functioning exists concurrently with deficits in adaptive behavior, conceptual, social, and practical, typically manifested before the age of 18. And in the school setting, the intellectual disability adversely affects educational performance. So I want us to be thinking about those two possible classifications as we start to take a look at the data. So in order to answer the assessment questions, first of all, whether or not achievement is consistent with age level and grade level expectations, we selected the Wechsler Individual Achievement Test, the 3rd edition. We also, for the ability section, the cognitive ability section, we selected the WISC-V, the Wechsler Intelligence Scale for Children, the 5th edition. And then in order to understand the child's performance on the WISC-V, we also administered a number of subtests from the WISC-V integrated as well as from the Berry test of visual motor integration. So you'll see how all of the data from these measures are actually integrated in order to give us information about the child's possible classification as well as his educational needs. So let's take a look now at the evaluation results, and I want to think about the distinction between an intellectual disability and a specific learning disability, and certainly one of the components will relate to the intellectual functioning. So the question that we'd asked is whether or not he's achieving age and grade level standards. So when I ask this question, I'd like to go first to the information that'll answer that question. I want to be able to confirm what the teacher is seeing in the classroom. And so the first set of data that I'm going to present to you are from the achievement measure, and I'm going to start with the oral language. Certainly, listening comprehension and oral expression are 2 of the 8 areas identified by IDEA for that SLD classification. But the reason that it's important for us to assess oral language is really because oral language is foundational to reading and writing. Oral language forms the foundation for reading and writing. Virginia Berninger talks about the fact that we learn language first by ear, which is the listening comprehension, and then by mouth, the oral expression, and then we introduce language by eye, the reading, and language by hand, the writing. So often children might have a specific learning disability in reading, and it might be a language-based learning disability. So when you look at Aaron's scores on oral language, notice his listening comprehension score is within the average range. His oral expression score, according to the Wyatt-3 descriptive classification, is also within the average range. 85 is the lower end of the average range. And one of the things that we think about when we think about reading really is vocabulary. Might a child be struggling with reading because he or she doesn't know what the words mean? Notice his scores for both receptive and expressive vocabulary are within the average range, 104 and 100. His ability to understand information in context, whether in sentences or in passages, is also within the average range, but a little lower than his vocabulary score. And then when you look at oral expression, notice that his scores for oral word fluency and sentence repetition are a little lower. And one of the things I want to point out for both of these two subtests is that both have that working memory demand, which I think we'll see later on is going to be important for Aaron. When we look at written expression, and certainly when you think about writing, writing starts off with basic scribbling, and then the child is able to form true letters, and then they're able to put letters together to make words, and put words together to make sentences, and so on. And when you look at Aaron's scores here, notice that his score for the essay composition, they're all within the low range. Certainly his ability to use information to write sentences, whether you're providing all of the information like in sentence combining, or maybe you're giving him a single word and asking him to use the word meaningfully in a sentence, his scores are in the 70s. But if you look at his basic writing, which is spelling, notice that his score for spelling is really low. And when you start thinking about what's involved in spelling, it's either that you're able to retrieve from long-term memory the visual representation of the word, and barring your ability to do that, what you'll do is you'll listen to what you hear, and you'll associate a symbol with the sounds that you're hearing in the word. So you're actually integrating the phonological, what you hear, with a visual representation, the orthographic representation. So think about spelling and how a weakness in spelling might actually impact his performance on both sentence composition and essay composition. The other area on which you want to focus is reading. And essentially, when you look at basic reading, which as we know, basic reading as well as vocabulary are both important when you're thinking about reading comprehension. And notice that his ability to recognize and name real words, again, is in the very low range. His ability to use spelling sound correspondences, especially when you're looking at words with highly predictable patterns, notice that his score was better than the scores of approximately 1% of others his age. When you look at reading comprehension and fluency, well, before I look at reading comprehension and fluency, I want to say that both of these subtests for basic reading assess accuracy, right? So if you can't read the words or name the words accurately, and you don't have the decoding skills to figure out the word, you will also struggle to read fluently. So you notice that his score for oral reading fluency is pretty consistent with his score for basic reading. When you look at reading comprehension, though, his standard score for reading comprehension is within the average range. Notice I have these asterisks following both reading comprehension and oral reading fluency. And I use the asterisk to communicate to us that his raw scores for both of those subtests are based on a below grade level item set. So what does that mean effectively? What it means is that when I gave him, and he's in grade 5, and we're using a grade 2 item set to evaluate his literal and inferential comprehension, when we gave him text at that second grade level, he was able to respond to literal and inferential questions. In the classroom, though, when we provide him with reading material at a 5th grade level, he is likely to struggle with comprehension because he is struggling with basic reading skills, both word reading as well as pseudo-word decoding. And when you look at math, notice that consistent with his own report and consistent with the grades that he was earning in lower grade levels, notice that his scores for math are at least within the average range. His math fluency is within the high average range. So again, you're thinking about a pattern. Are you seeing a pattern of academic strengths and weaknesses? And certainly I think the pattern that will stand out for you has to do with math, and math in relation to reading and writing. Oral expression and listening comprehension are also within the average range, but when you look at reading and writing, those really lower scores, notice that compared to math, math would be a relative strength and reading would be a relative weakness, so would writing. So when you look at these comparisons, for example, basic reading versus math fluency, the difference between the standard score for basic reading and the standard score for math fluency is 53 points. If that different score exceeds the critical value, you'll say that that different score is significant. It's a statistically significant difference. And a difference of that magnitude is unusual or rare, occurring in less than 1% of other children his age in our standardization sample. So based on what we have here, you see this pattern of academic strengths and weaknesses where reading and writing or language arts would be a relative weakness and math would be a relative strength. So just to ask you a question, based on what you have here, the information you have so far, do you believe that Aaron has an intellectual disability? Maybe yes, no, maybe? All right. Thank you for your responses. Most of us are thinking no based on the information we have so far. Some people say maybe. A few of you are saying yes. Okay. Okay. All right. Thank you so much. I want to back up here for 1 second to talk just a little bit about a question that came through, and I think it might be one that other people might have as well. The question was about reading comprehension. When you use the WISC-3 and you have to administer a below grade level item set, and that's going to depend on you're following the basic item set rules, depending on the score on the reversal set of items you may need to reverse, and you can reverse up to 3 times. Now, here's what happens. When you actually reverse and you convert you'll generate a raw score based on the item set that you're using. That raw score is going to be weighted based on the child's actual grade placement. So if I used a grade 2 item set, that raw score is going to be weighted for a child in grade 5. And so the score that you have really is based on the performance of grade 5 children on that grade 2 set of passages. So often if in fact, let me just say this, it's not always the case. You don't always have a higher standard score necessarily. But if in fact I am struggling with reading comprehension because of a weakness in basic reading, reducing the readability demands will actually remove that weakness in basic reading, that confound, if you will, and therefore that score will tell me now that this is the child's weakness in reading comprehension is not because of a weakness in comprehension, probably not because of a weakness in vocabulary, but if I give him text that he can decode, he's more than likely able to respond to questions. So the second assessment question, now we have information about achievement, and I know that there is a pattern. I don't have consistent scores across content areas. I have relative strengths in math, relative weakness in language arts. Now I want to know whether or not his achievement is unexpected relative to his cognitive abilities. And those of you who said that more than likely he doesn't have an intellectual disability, you were probably thinking about his actual achievement. And when you see a child who's able to earn scores or standard scores of 116 or close to 100, it is probably unlikely that his cognitive abilities would be in that sub-average range, 75 and lower. So that's probably something that you can infer based on those achievement scores. He probably will have cognitive abilities at least within the near average range, or maybe we might see, similar to the academic area, we might see a pattern. So let's take a look at that now. And we administered the WISC-V, as I mentioned, to assess his overall cognitive ability. And when you look down here at his full-scale IQ, notice his full-scale IQ is 77. So when you think about the full-scale IQ and you think about that generally sub-average intellectual functioning, certainly it would appear that that full-scale IQ is close to that cutoff range. When you look at the 7 subtests, the scores for the 7 subtests that make up that full scale, similarities in vocabulary, block design, matrix reasoning, figure weights, digit span, and coding, you notice that those subtest scores range from a low of 5 to a high of 11. So when you have such variability, and you have variability within the indices, what that tells us is statistically that index score doesn't represent a unitary construct. So when you think about the full-scale IQ of 77 being made up of such variable subtest scores, the full-scale IQ of 77, although that is a valid score, and sometimes we get the question, is it interpretable? It is not a unitary construct, so it doesn't tell us everything we need to know about the child's ability to think and reason. However, as long as we administered the subtest according to standardized procedures, the child was engaged and put forth appropriate effort, that full-scale IQ is a valid score. However, in order for us to understand this child's pattern of cognitive strengths, we probably need to take a closer look at the index scores. So when you look at the index scores, I want to start out by looking at two indices where the scores are highly consistent. So verbal comprehension, similarities, scale score of 6, vocabulary, scale score of 5. When you think about verbal comprehension and you think about what verbal comprehension measures, certainly you are thinking about being able to demonstrate word knowledge and then to be able to reason with words, similarities. When you think about similarities and vocabulary, a child may earn low scores on these subtests for a number of reasons, right? One might be that I simply don't know what these words mean, so poorly developed word knowledge. Or it might be that I struggle to retrieve the meaning of the word from my long-term memory. Or it might be that I can't tell you the answer. I'm struggling with verbal expression. Or it might be that I have general difficulties with reasoning and problem solving. We don't know exactly which of those would actually explain these lower scores for Aaron, but we could take a look at this pattern in order to generate some hypotheses. So when you look at information and comprehension, the secondary subtests, notice that his scores are pretty consistent there as well, even though we're not using those to calculate the full-scale IQ. So one of the things that I might be able to rule out quickly would be general difficulties with reasoning and problem solving. Why? Because when I look at his scores on fluid reasoning, which those tasks also require general reasoning and problem solving, you'll notice that his scores are within the average range and his scores are pretty consistent. So fluid reasoning, again, a measure of general when you think about the ability to identify the underlying conceptual relationship among objects and then to use reasoning to identify and apply rules, certainly he appears to be able to do that. Also, the other thing that you might be able to rule out would be poorly developed word knowledge. We just saw on the Wyatt-3 that his receptive and expressive vocabulary were within the average range. So his word knowledge seems to be at least consistent with age expectations. When you look at some of the other two, and the two indices where the scores, the subtest scores are consistent would be verbal comprehension. That one appears to be a weakness relative to fluid reasoning, and fluid reasoning where the scores are consistent as well. But when you look at the other indices, for example, the visual spatial index, notice that the scores for the two subtests that make up visual spatial, there is variability there. So you want to start thinking hypothetically about the abilities measured by each of the tasks that make up that visual spatial index. So when you think about block design where you're asking him to use his hands to assemble blocks, maybe block design has a more significant visuomotor or constructional demand than visual puzzles, which requires more visual, perceptual, and spatial reasoning abilities. So block design also requires the visual, perceptual, and spatial reasoning ability, but in addition, block design requires that visuomotor or that constructional ability. When you look at working memory, notice that the two subtests that make up working memory, digit span and picture span, again notice the variability at the subtest level. So he showed age-appropriate performance when you asked him to recall a series of pictures in the correct order on picture span, but his performance was comparatively lower on digit span, which required him to recall and sequence strings of numbers. So maybe hypothetically, he uses his working memory more effectively when a visual stimulus as opposed to a verbal stimulus is used. And also, I want you to keep in mind that on picture span, you are really using a recognition paradigm. You're asking him to recognize something that he saw before, whereas on digit span, he's actually supposed to recall or to engage in free recall. So again, think about the abilities that are unique to each of these tasks. And then finally, the last one, and again, you'll notice the variability of the two scores that make up processing speed, certainly coding and symbol search. He did better on symbol search, which might tell us that his visual scanning is a strength, relative to the associative memory, which is one of the abilities measured by coding, as well as the graphomotor speed. Coding has a much more significant writing demand than does symbol search. So when you look at all of the information that you have here, you start thinking about patterns, right? Is there a pattern that you could see? Is there a pattern that you can see that might lead you to an ability or maybe several cognitive abilities that are shared by some of these tasks with those relatively lower scores? And one of the things that I hypothesized is that when you think about tasks that have significant expressive demands, whether you think about verbally expressive or you think about motorically expressive, like on block design and maybe coding, for example, it seems as if when you think about these expressive demands, the verbal expressiveness or the motorically expressiveness, that is maybe where the struggle is happening for Aaron. And that would maybe be consistent with what his parents reported, that he was struggling in childcare and preschool with expressive language as well as with the fine motor skills required for drawing. So again, I want you to think about a pattern, right? When you look at his cognitive abilities, do you see a pattern? And really, I think what you see in terms of a pattern, and you could look at the index scores and see that, is that fluid reasoning is probably a relative strength. We looked at a comparison score, the mean index score. Compared to that, the mean for the 10 subtests that make up the 5 primary indices, the mean of 87.8, fluid reasoning is a relative strength. A difference of this magnitude is statistically significant as well as clinically significant, and verbal comprehension is a relative weakness. So again, in terms of a pattern, think about what you're seeing, because we're thinking about maybe that third method when you think about SLD classification, eligibility determination. You could also look at the index level pairwise difference comparisons. I'm not sure that this information is as meaningful clinically, and that is because most of your index scores, as we pointed out, are not, the score doesn't represent a unitary construct. So when you think about the visual spatial index, the working memory index, and the processing speed index, you're not thinking about unitary constructs. But really, I think the one that would be instructive for us would be the VCI to FRI comparison. And again, notice that the difference between the two is statistically and clinically significant, which again, when you think about a pattern of strengths and weaknesses, will tell you that verbal comprehension would be a relative weakness, fluid reasoning would be a relative strength. We also looked at some of the ancillary indices, and you probably came up with some ideas about what you wanted to know a little bit more about when we looked at this secondary subtest on the working memory index, letter number sequencing. Digit span and letter number sequencing are combined to yield the auditory working memory index, and notice that that index is 75. The working memory index, as you know, has the visual as well as auditory modality, whereas the auditory working memory index has only the that verbal modality. The quantitative reasoning index might be instructive as well, especially when you think about his relative strengths in the achievement area in terms of math. Those are the two ancillary indices that I think are clinically meaningful for us. When you look at the others, again, you'll notice the variability at the subtest level, which means that the overall score doesn't represent a unitary construct. And then we also administered the complementary subtests, and of course we wanted to do so because the referral concerned reading. And we also noticed on the achievement measure that basic reading was a relative weakness for him as well as normative weakness. Naming speed consists of two tasks, naming speed quantity, where we present a quantity and ask him to tell us quickly tell us the number that represents the quantity, and the quantities go up to 5. And naming speed literacy, his score for naming speed literacy based on his age is based on a letter number task. So the reason why I want to point that out is because when you think about presenting letters and numbers, there is a significant executive function demand where the examinee is constantly switching mental set from number to letter, and you're not sure if the next one is going to be a letter or a number. So when you think about executive function is really important when you think about learning. Also, the ability to learn and remember information, symbol translation, that visual verbal associative learning, his scores are within the average range. So in terms of storage and retrieval, which is based on his performance on the naming speed and symbol translation tasks, his ability to store information in short-term memory and to retrieve the information from short and long-term memory is also within the average range. So I had a few questions about verbal comprehension when I looked at the WISC-V, right? I really wanted to know what explained these relatively lower scores. I maybe ruled out the poorly developed word knowledge. I ruled out the general conceptualization and reasoning. But one of the things that I hypothesize and I know is related to performance of these 4 subtests is expressive language. The output demand of this task is verbal. So what I wanted to do was to remove that expressive demand so that I could get a better sense of Aaron's abilities related to the content demand of each of these tasks. So like on vocabulary, I want to know if he knows the meaning of these words. So what we did on all of these is we used the WISC-V integrated, which, as you may know, has a multiple choice version of these 4 WISC-V subtests. So when we administered WISC-V multiple choice, where not only can he point to his answer, but we're also presenting the responses in the stimulus book, and so we're in effect also cueing his recall. This is no longer free recall. Notice that his score on similarities on WISC-V was a 6. His score on similarities multiple choice was 12, his scale score. For comprehension multiple choice, scale score of 15. Vocabulary has 2 tasks on WISC-V integrated. For both vocabulary multiple choice and picture vocabulary multiple choice, notice his scale score was 10. For information multiple choice, although he responded correctly to more items on information multiple choice than he did on information, the raw score did not improve enough to improve the actual scale score. But notice what happened when you actually reduced the verbal expressive demands and when you cued his recall, when you provided him with choices, notice the improvements in his scale scores. So when you look at WISC-V and WISC-V integrated, on WISC-V, we had an index score for the VCI of 76. You can calculate a multiple choice verbal comprehension index based on his scale score for similarities and for vocabulary. That is 105. Notice the difference between the 2 is significant and unusual. Now, I need to point out, just to remind you, that even though you see these improvements based on the WISC-V integrated, these scores do not change your primary index scores. So if you're going to be using the full scale IQ to determine classification and eligibility, your full scale IQ is going to be 77. Or if you're going to be using the fluid reasoning index, as you know, you could use either of those indices as we describe in the manual, and certainly whether or not you can use them will depend on your district requirements as well. But according to what we describe in the manual, you could, for example, use the fluid reasoning index. But these scores here will help us to understand the child's needs in the classroom because they help us to understand why Aaron earned these relatively lower scores on the WISC-V. Here is another thing that supports our hypothesis, which we've now confirmed, and that is that concurrent with our evaluation, the speech-language pathologist also evaluated Aaron, and based on her test results, she diagnosed him with a severe expressive language disorder. The other area that we had questions about really was maybe the visuomotor coordination tasks on WISC-V, so like block design and coding. And notice for block design multiple choice, again, when we removed those visuomotor coordination demands, notice his scale score improved to 10. For coding, coding really has two component abilities that are required. You should be able to learn and remember the relationships between, for Form B, the number and then the symbol, so that incidental learning is an important part, and you should be able to copy. So I want to know maybe if it was the copying, the visuomotor coordination, which is my hypothesis, and notice when I administered coding copy, his scale score was a 5, just like his scale score on coding. But when I tried to assess incidental learning, did he make those associations and does he remember the associations? Notice on the coding recall task, his performance is within the average range. We also administered the Berry-Buktanica developmental test of visual motor integration. His standard score was consistent with these scale scores for block design and for coding. And then for working memory, that was the other one about which we had some questions. Is it auditory working memory or is it modality specific? So we administered spatial span. Notice his scale score of 9. And what we want to do is maybe compare auditory working memory and visual working memory. And visual working memory is based on the scale score on picture span and on spatial span, so one from WISC-V and one from WISC-V integrated, and the index score of 97. I want to see if his auditory working memory abilities are a weakness relative to his visual working memory abilities, and that is, in fact, what we find here. So to think about his cognitive strengths and weaknesses now, think about fluid reasoning, certainly the abstract thinking. Also think about the quantitative reasoning index. And then in terms of weaknesses, certainly the auditory working memory, the expressive language, and the visuomotor coordination, all of which were required on several of those WISC-V tasks. And his performance on those tasks was adversely affected by these relative weaknesses. So you want to think about these relative weaknesses, and especially in conjunction with the academic weaknesses that we documented. So when you think about math as a relative strength, what is the relationship maybe between abstract thinking, quantitative reasoning, and math? What is the relationship between abstract thinking and maybe one of his academic weaknesses, maybe reading decoding? And then when you look at some of the relative cognitive weaknesses, what is the relationship, both the theoretical or the theorized as well as the empirically demonstrated relationship between auditory working memory, for example, and reading decoding? And so certainly I think we can review the literature and we can find the relationship documented in a number of studies between cognitive processes and reading, for example. Certainly verbal comprehension and working memory are really good predictors of reading ability, especially verbal working memory. So again, think about Aaron and think about his verbal working memory. Children diagnosed with a learning disability in reading tend to show reduced verbal working memory as well as processing speed deficits. Other studies document the importance of rapid automatic naming. What we're assessing with naming speed literacy, Aaron scores were within the average range. Children with reading disorders also tend to perform poorly on verbal learning measures, such as on symbol translation. Again, for Aaron, we didn't document that. But when you think about math, certainly some of the same cognitive processes, verbal comprehension, working memory, and processing speed. Working memory, again, several studies that have documented the relationship between working memory and performance in math. And processing speed, again, an important predictor. So one of the things that we did with this particular case study is to think not just about underachievement relative to ability, but to think in terms of patterns, and to maybe think about cognitive hypothesis testing. So when you think about cognitive hypothesis testing, certainly PSW analysis, or pattern of strengths and weaknesses analysis, is one of the methods that are used with that third method identified by IDEA, that pattern of strengths and weaknesses. So when you think about a pattern of strengths and weaknesses analysis, you're thinking first about looking at an achievement weakness. And certainly for Aaron, basic reading is one area, spelling is another, reading fluency is another. But I'm presenting the data here just for basic reading, but you'll perform the same analysis for spelling and for other areas on which you want, other achievement areas on which you want to focus. Essentially, what you want to see is if the processing strength that you choose, and I am choosing as my processing strength the Fluid Reasoning Index, and fluid reasoning, I think, is an appropriate strength to use in a PSW model because fluid reasoning is not strongly related to achievement in reading and writing. And what you want is a processing strength that is not theoretically linked to the area of underachievement, and you want to choose as your processing weakness an index or an area that is linked theoretically to the area of achievement. So essentially, you're looking at concordance and discordance, and what you want to find is that there is discordance, if you will, between the processing strength and the achievement weakness. So look at the difference between the two scores. Is the difference significant? In which case we would say that that supports an SLD hypothesis. And then what you want here is to look at the processing strength and the processing weakness, and again you want those two to be discordant, and that is the case. So both of those comparisons would support an SLD hypothesis. Hale and Fiorello, who are the researchers who describe the concordance-discordance model, certainly there are other models that you can use as part of a cognitive hypothesis testing approach, but they also talk about that there should be concordance between your achievement area and your area of processing weakness, in which case you might hypothesize that the underachievement in basic reading in this example is theoretically related to that relative weakness in auditory working memory. So the question is, can we rule out an intellectual disability? What if you have that pattern of scores that I described for Aaron? Can you rule out an intellectual disability? So I pulled out a special group study from the WISC-V, and one of the things that I want you to see is that across the composite scores, whether you're thinking about the full-scale IQ, the primary indices, the ancillary indices, the clinical means, the means for a special group of individuals who were diagnosed with an intellectual disability, mild severity, their composite scores tend to cluster around the 70. The one that's slightly higher is the processing speed index, which is 71.6. Essentially what we're saying is if you are working with an individual and that individual will meet the eligibility criteria for classification of intellectual disability, you will not have that variability in terms of your scores. Your scores will be relatively consistent and close to 2 standard deviations below the mean. So I know that this comes up, and I used to work in a school district where we had this, where you might have an IQ score of maybe 75, and you have that variability, such as I described for Aaron, and we might actually end up classifying that child with a specific learning disability because we were using a simple difference methodology. And if the achievement scores were 15 points lower than that full-scale IQ, we'd say that child meets the eligibility criteria for classification of specific learning disability. When you look at that's going to depend on your district regulations, but when you look at federal criteria, really children with specific learning disabilities tend to have near average or at least near average intellectual abilities. Children with intellectual disabilities tend to have generally sub-average, closer to 70 in terms of intellectual disabilities. And I will tell you that in my experience, if you ever had the opportunity to be visited by the Office of Civil Rights, that is what they're looking for. Is there a consistent pattern when you are looking at those scores? If you have maybe a scale score of 7 or 2 scale scores of 7, then they'll probably ask you to justify your classification of intellectual disability. So to conclude then, his achievement in math is consistent with his average fluid reasoning index. His low reading scores are consistent with his lower verbal comprehension index. We notice difficulties across the spectrum of reading skills, and we conclude that his performance is typical of the performance of students with specific reading disorders. He's unable to integrate the phonological and orthographic features of words, pseudo-word decoding, so that his difficulties with decoding also affect his spelling. So both pseudo-word decoding and spelling require the integration of the orthographic and the phonological codes. So essentially, to summarize, you will determine eligibility. What's important is to recognize that his teacher's impression that he might have an intellectual disability was really based on his limited verbal abilities. His limited verbal intelligence is really because of the weaknesses in expressive language and also because his reading difficulties. A lot of the words that we learn from reading, and he struggles with reading, so his vocabulary is not expanding. But when we provide multiple choice paradigms, he has a much better opportunity to show us what he knows. So as an IEP team, you may want to consider a classification of specific learning disability in reading and written expression, and also consider maybe speech and language as a related service, and possibly also occupational therapy if that is supported by an occupational therapy evaluation. And again, maybe making sure we offer him books on tape, again, to kind of bypass the weaknesses in reading, and maybe test-taking accommodations, especially for math, because what we're finding is that his scores are probably dropping in math as the problem-solving, the verbal working memory demands increase. And then the important thing that the teacher learned from all of this information is that maybe in order to increase his contributions in the classroom, she would ask him specific questions, and she would provide maybe alternative answers from which he could choose. So thinking about maybe not that free recall paradigm, which we know is a weakness for him, but thinking more about that cued recall paradigm. Okay. So I know there are a few questions that are coming through, and my colleague, Dr. Kimball, has been responding to those. If there are any additional questions, we'll take a look at those, and we'll probably take a look at all of the other questions as well and compile those in a frequently asked questions document, which we'll share with all of you. But if you have any specific questions, please send them to me. My email address is here, and any general questions or customer service contact information is here as well. I want to thank you so much for joining us, and I apologize, I'm just a few minutes over here. But thank you for hanging with us, and we hope you'll join us in the future on another of our webinars.